right. So here we are. We're going to be talking today about HIV and AIDS. Now, we did this in the past, and it was like a very rushed production. Today is a much more chill production because I want to do well on this next test for no other reason than I want to. So that's what we're going to do. Oh, look at that, another title card. So, HIV and AIDS, which is a very important thing to remember about HIV and AIDS, is that it is what does it stand for? Okay, HIV, human immunodeficiency virus, and AIDS meaning acquired immunodeficiency syndrome. Okay. Now, what does that mean? Well, that means that ultimately the problem with somebody who has HIV or AIDS is that their immune system is not working very well at all. Yes. So the way that this comes down to is that this person will be dealing with they'll be facing a lot of enemies on a lot of different fronts. Some of those fronts being, different bacterial infections, viral infections, you name it. This person will be at a disadvantage because their immune system is not up to par. Well, now, what does that mean? What aspect of their immune system is not working? The problem in the case of AIDS is CD4 and helper T cells, okay? What do those cells do? Well, in somebody whose immune system is, working, those cells are kind of the ones who figure out which are the bad viruses, okay? So those helper T cells and CD4 cells are there to kind of recognize friend from foe in a lot of cases. Now, in a normal immune system, the CD4 and helper T cells will latch onto something and be like, "Hey, this is bad. We should flag this. This is not good," which then allows the rest of the immune system to kind of notice and pull out their freaking bazookas to destroy it. Your immune system is not your friend, okay? The immune system is there to keep you alive, but at the end of the day, the immune system don't want to lose. The immune system would rather have you die than lose. So they'll just be like, you know what, let's blow this thing up. How about that? Press the self-destruct button. Maybe that'll kill the virus. Goodness. But, okay, normally CD4 and helper T cells are able to say, this is bad, we need to kill this, okay? Now, you can imagine that if you don't have that, your body's ability to figure out how to fight viruses and even bacteria and even which ones are the viruses and bacteria probably go down. Your body has a much bigger problem with noticing that kind of stuff. But so let's talk about viruses. Now, viruses are not bacteria. That's a really important thing to understand. Bacteria are little cells, little ooby-goobies with flagella or whatever that kind of roam around, and they are at their core, they're little microorganisms, okay? That's kind of the way I think of bacteria. There are cells involved and different, appendages involved with bacteria. Viruses are a little different. Okay, they're not different in a good way. Viruses are their own breed of problems, okay? Viruses are basically just little cases of DNA. That's literally all they are. They are little cases of DNA, all right? The thing that call something a thing, that's what they are. They're a little case of DNA. Now, this little case of DNA can only replicate its DNA using your DNA replication structure, okay? We talked about cell division, the mitosis phage stuff, and the virus works by essentially inserting its own DNA into your DNA, which then makes it so that your cell says, oh yeah, let's go ahead and just replicate this virus's DNA, henceforth making more of the virus, okay? And then once the virus has made more of itself, this process goes and goes and goes until either the cell can't sustain the viral production and dies, or... yeah, that's kind of actually what happens. The virus just produces and produces and produces until the hosts cannot possibly produce any more cells. Now, in the case of HIV, the virus loves helper T cells and CD4 cells, okay? They love them. So they'll go into those cells, do their whole virus process. Well, now eventually that cell will just straight up die. It's not really helping itself, it's just making the virus. That's its only job. So because the virus targets the CD4 cells, not only making it so that they're working towards helping the virus and not helping you, but they're also going to work worse. Like, they're also going to not do their job as well because they got some sort of parasite basically working inside of them. So, where even was I? So ultimately, the CD4 count, okay, the count of viable CD4 cells in somebody who has HIV will go down. That's really important to remember. The viable CD4 count eventually goes down because the cells cannot sustain themselves. The virus is taking over. Eventually, there is a point where the person may get to a point where they have so few CD4 cells left that their body cannot fight off infections, and that's where we get to AIDS. But that's a little bit ahead of ourselves, okay? The reason that we are looking at this life cycle of HIV, talking about the little protovirus, the virion, that then enters into the cell, goes inside, gets its DNA out, inserts the DNA inside to the nucleus. Then the nucleus now of our cell starts producing the virus. More virus is created and then travels outside the cell, okay? The reason we're looking at this is because it can help us kind of put in place weak points in the virus's cycle, okay? If we had drugs, which we'll talk about later down the line, if we had drugs that could target the virus at key points in its replication, we could halt replication of the virus. It's not going to get rid of the virus. The virus is still there. It's just that the viral load, right? This guy, he's still just one guy. He hasn't become two guys yet, okay? And this two guys can't become four guys, okay? That's the good news. So if we can keep it here where the viral load is so low that maybe there's 1 or 2 or 3 or 4 CD4 cells affected, it's usually higher than that, but that's, a little bit here and there. If we keep the number of infected cells low, they're not really doing a whole lot. The virus isn't being reproduced, so we can essentially halt the progression of HIV if we are, quick and the person's immune system is receptive to it. Now, there's going to be some downsides. This is not the perfect therapy, but this is a plan that people put in place so that we can perhaps halt the progression of HIV. Very important, okay? But the question is, how is HIV transmitted? Now, back in the day when HIV was like scary, new, and big and really, really devastating, people didn't really know how it was spread, so they were just making stuff up. They were afraid to touch people. They were afraid to, come within 3 feet of people because they were like, well, maybe it's like tuberculosis, and maybe if you, spit on me during conversation or something, I'm going to get HIV, and then I'll get AIDS, and then I'm going to perish. But now, after, the disease has run its course a bit more, we know that HIV can only be spread through a couple of key places. The first of all being through sex. So the vaginal fluids and sperm that are exchanged during sex, no matter which type you're going to have, those can carry the virus, okay? So vaginal sex, 100%, anal sex, yes, and then oral sex. Now, oral sex is a little different, okay? And the reason that oral sex has two little asterisks is that saliva itself doesn't carry the virus, okay? Your saliva has little things in it that actually don't allow AIDS to be in there. It's got some... saliva is pretty rad, okay? But if you were just kissing, you're not going to be spreading AIDS. And that's not what oral sex is. Let's be real, people, okay? That mouth is coming in contact with vaginal fluids or sperm, potentially, okay, discharge. And it is through those modes of transportation that our virus can be, spread. So we'll talk about ways to prevent transmission in the next slide, but I bet you can guess it comes down to practicing safe sex, as safe as you can. And then through blood, all right? That's two big ones, okay? If you are sharing IV needles, if the person who you got the IV needle from had AIDS and you just stuck that right into your vein, well, now the chances of you getting a bit of those little HIV particles has gone way up. If you accidentally needle stick yourself, this one is a little prevalent when it comes to nursing because, sometimes you get clumsy. Sometimes you get a little bit silly. And so you just stuck a patient that has HIV and then, oh no, I just stuck myself with that same needle because I don't know what I was doing. I'm not going deep into this scenario, okay? So now there's a chance that you've gotten a little bit of that HIV bug in you. And then transfusions. Now, transfusions used to happen, like the spread of HIV through transfusions used to happen more than it happens now, because now we know that transfusions can transmit HIV. So, they are usually very, very good about screening things and cleaning things and all of that. But in theory, right, if the blood donated to a blood bank was not screened and tested for HIV and there was HIV in the blood, then somebody who the blood was transfused into could potentially get the virus. Similarly, but differently with dialysis machines, if somebody who had AIDS needed to get dialysis and or even HIV, it could be either or. Goes in to get dialysis, they do the dialysis, and the machine isn't properly cleaned, well, little bits and pieces of that person's blood might still be in there. So the next person that comes in and dialyzes with that machine has the potential now of getting HIV from the poorly cleaned dialysis machine. So, moral of the story, it doesn't happen often because now we know that it can happen and people are much less likely to mess around with that. No, thank you, says everyone, okay? Just things to keep in mind, especially when it comes to patient education, because AIDS is really scary, not just for the person who's got it, but also for the people that are close to that person. Do they also have it? Maybe that, they already have had it. How do I, as the person who has HIV, stop it from infecting the people around me? So you need to be able to know this stuff. And then perinatal. So, during, birth, specifically and mostly vaginal birth, the mom's and the baby's blood will mix at one point, okay? I don't exactly remember when, and honestly, it's not the most important thing. What is important, though, is that the blood will mix, and that is why, knowing the baby's, if the mom is Rh negative, they're going to be given RhoGAM, because even if the baby is Rh negative, we don't want to have the chance that blood mixes and either side of that blood decides to hemolyze because it just really, 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 really hates the antigen, okay? They don't like the Rh antigen or whatever. They create antibodies, the antigens go out. Long story short, it's going to look a lot like a bad transfusion, right? Like there was a problem with their blood. So during a vaginal birth, right, the whole point of this is that even if mom and baby's blood is totally compatible, whatever, if mom has HIV, during that mixing of blood with baby and mom, the baby is now at risk for developing or catching that HIV infection because the mom's blood and the baby's blood mix for a minute, just for a quick second, and now we've got a problem. And breastfeeding, so HIV can hang out in breast milk. So if you have HIV and you're going to be a mom, very likely they'll do a C-section on you so that they can limit the exposure that the baby has to your own blood. In fact, basically make it negligible. They don't want your blood to mix at all. And then 2, you're going to feed them with formula, right? You can still pump in whatever, but you shouldn't pump if you don't want to breastfeed. Anyway, stuff to know. So what is it not transmitted through? It's not transmitted through saliva. It's not transmitted through urine, feces, sweat, touching, or through, like airborne stuff. You can't breathe into somebody and they're not going to get AIDS from you breathing on them heavily. So yeah, we talked a little bit about how safer sex is important to stop or at least prevent the transmission of AIDS. I mean HIV. I say that wrong all the time. I have to get it right, but it is what it is. The big thing with that is barrier protection methods are going to be great. So, like latex or polyurethane condoms. If you have a latex allergy, definitely don't use them. But for genital and anal intercourse, if there's any chance of fluids being, even touching, like if it's vaginal fluid, okay, if it's I mean, in theory, if you were. It sounds crazy, but if you were doing anal and there were no fluids involved, like if you were, like, not using. You know what I mean? Like, you weren't using. You weren't. There weren't going to be any fluids exchanged, then you would probably be fine, but. Because it's not transmitted through feces, so you don't have to really worry about that. Just condoms. It's a smart idea. And then a water-based lubricant, because if you're using an oil-based lubricant, it will break down the latex in the condom if you're using a latex condom. It's okay to use an oil-based lubricant with polyurethane. I looked that up, but overall, water-based lubricant is important to know. Don't use that with a latex condom. I mean, I'm just kidding. Use a water-based lubricant with a latex condom. Don't use an oil-based one. Sorry, my brain is a little bit foggy. You should also use a condom or a latex barrier, like, over the genitals or anus during oral genital or oral anal sexual contact. For the same reason. Hold on. I want to look up. This is crazy. Let's say, can my rectum. Fallout is a great one. Can my rectum transmit HIV? Yes, rectal fluids. Hey guys, just kidding. Rectal fluids, not feces, but rectal fluids. Like now this might be TMI, but like that. The mucus that comes out sometimes when you've had a really, really crazy poop. Hey, it's called living, alright? If you haven't experienced that, you haven't lived, by the way. Anyways. Yeah, there's a little mucus in there to help things flow easy. So, yeah. There you freaking go. So, always wear a condom. Even if you're not planning on, squirting around in there. Just wear one. But yeah, so condom or latex barrier over the genitals or anus during oral genital or oral anal sexual contact. For the same reason. You're hoping to prevent transmission. Latex gloves for finger or hand contact with the vagina or rectum. And that is really just a precautionary thing. Like, if you had a cut on your hands or something and you're going crazy down there and the other person has HIV, well, there is a chance for that cut in your hands to soak in some of those fluids, and now you've got potentially have some HIV in you. Just things to think about, Just use protection. Be safe. That's the biggest thing. Signs and symptoms of HIV/AIDS, because HIV and AIDS are kind of like, I don't know, AIDS is like the Pokemon evolution of HIV. So you start off with HIV. You can have HIV and you may not know it for kind of a while. Initially, the signs and symptoms of HIV are going to be like flu-like symptoms. Maybe a little cough, a little fever, maybe a little sniffly, You might have some night sweats, chills, joint muscle pain. But you're gonna, like, a lot of people will see that stuff and they'll be like, oh, must be a little bit sick. I'm just gonna eat more vitamin C and call it a day. It's during this time that the person is the greatest risk of transmitting. Because if they don't know that they have HIV, they're going to just continue doing what they're doing, probably not using protection. Dingbat. Just kidding. Not really. And so now they're at the highest risk for spreading their disease to other people. This is called HIV stage 1, okay? It's also known as like an acute infection. You just get some sort of infection with HIV, and you get those flu-like symptoms. You get those flu-like symptoms for like 2 to 4 weeks, or within like 2 to 4 weeks of exposure. So you're kind of like, I feel a little bit under the weather. And then maybe you go and try and get somebody to check you out. Maybe you don't, okay? Then, after the acute infection stage, you go into stage 2, HIV stage 2, which is the latent period. The latent period of HIV infection is like chronic. I mean, obviously, like you're just there. It's going to be a longer period than the acute infection, okay? Usually, though, during this period, you're not going to have any symptoms. During this time, the virus is just continuing to replicate using your CD4 cells, but ultimately, you have enough CD4 cells to function. Like, they can do what they need to do, and only a couple of them are really going to be used for these virus factories, okay? But eventually, and we'll talk about when during this time you don't have AIDS yet, okay? Your immune system can still fight stuff off. We want to catch AIDS we want to catch HIV before it turns into AIDS, okay? Because we talked about how a lot of the drugs that we have right now can help to halt the progression of HIV into AIDS by just stopping the virus from being produced. So we will always have this kind of set level of viruses sitting around. But even though we've got this set level of viruses sitting around, they can't continue to multiply, or it's been way, way, way slowed down, so that the person can kind of live a normal life. They just have to be really smart, okay? We want to keep that viral load as low as possible, okay? So once, that's HIV stage 2. You get a couple of flus here every flu-like symptoms every once in a while, but overall you still feel basically the same. And so we would love to catch it in HIV 1. If we can't catch it in HIV 1, we'll catch it in HIV 2, we hope. And if we can't catch it in HIV 2, then the final stage of HIV progression is HIV 3. And that's where we get into AIDS territory. Once you hit AIDS territory, there's really no going back, okay? This specific point is when we have way more viral, like virus cells than CD4 cells. In fact, I think, it'll say it on the next slide, but the number of CD4 cells that remain in order for it to be classified as AIDS is less than 200. Now, do I know the units for that? No, I don't. Okay? No, I freaking don't. And honestly, it probably won't show up on the test, but if it does, it's 200. Less than 200. Now we've got AIDS. At this point, your immune system has a really hard time. In fact, it might not even be able to fight off certain infections that it would normally be able to just instantly kind of turn off, So you're going to see symptoms all over the body because our immune system works everywhere. And, I have like a love-hate relationship with my immune system for sure, but ultimately it does want to win. And I do want it to win against things that could kill me, or hijack my system. But what you'll see a lot of times in cases of AIDS is that the people that get really, really sick, the flu is definitely going to be really, really devastating to them, but you will first start to see that they've got these issues because it shows up as opportunistic infections, okay? What are opportunistic infections? Okay. Our bodies naturally have microbes in them. That can kind of be shocking to people because they're like, what? What do you mean it has microbes? Are you freaking kidding me? Yes, it can have microbes in it, which is fine. Our microbes are normally supposed to help our flora of our body, especially in our gut, to progress and work really well, okay? The problem, of course, is when those microbes aren't regulated by anything because our immune system is totally compromised, allowing them to sort of, you know, tiptoe across the line and kind of start to do things that they shouldn't be doing. That's where we get things like C. diff, where the microbes from one part of the gut try and go somewhere else, and now we have a real problem. So we're going to see GI symptoms that could be anything from diarrhea, constipation, to, I don't even know, like blood in the stool. It could be really, it's not a good situation. You're going to also, yeah, not good. You're going to maybe see some neuro issues, showing as like cognitive impairment. And that has to do probably with just the fact that there can be waste buildup causing kind of encephalopathy, just because your body is constantly trying to fight off infections, leading to an accumulation of just gunk that needs to be excreted. As well as like different cancers that can start to happen. Yeah. Yep. And we talked about cancers. The big number one sign for AIDS, or like the number one thing that people will talk about as far as cancers and AIDS, is Kaposi sarcoma. I spelled Kaposi sarcoma very wrong, by the way. It's actually Kaposi, like with a K, Kaposi's sarcoma. And you'll see it written out, and you'll realize how stupid it looks that I spelled it like that. But whatever that freaking word is, it looks like purple lesions all up and down your skin, okay? Yeah. I do want to know, like, what other things does Kaposi's sarcoma do? There it is. La 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 la. Okay. So it typically presents as purple or red lesions on the skin, often on the legs. Other symptoms may include swelling of the legs, pain in the lesions, lymph node enlargement, and GI problems such as abdominal pain and nausea. Cool. So basically, I guess, is that it? Lit. Okay. So that's a big one. And then lymphoma or Hodgkin's disease. Let's look that up. Hodgkin's disease. It's a type of cancer that originates in the lymphatic system. Ooh, look at that bump. What the sigma? I'm sorry. I'm so freaking sorry. Anyway, the exact cause is unknown. That's cool. Blah, 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 blah. You'll see swollen lymph nodes, typically in the neck, armpits, or groin. Fever with Hodgkin's lymphoma or Hodgkin's disease. Sure. Night sweats, weight loss, itching, fatigue. Very cool. Yeah. And who's at risk for this? HIV infection, Epstein-Barr virus. Yikes. I mean, it's not going to kill you. It's rough. Like, it's not fun. It's not good. And it requires treatment. Yikes. Wasting syndrome. There's a lot of reasons why somebody with HIV, well, I guess AIDS at this point, might go into wasting syndrome. Wasting syndrome is a process where your body essentially is not getting enough nutrients, and so you waste away, as the name would suggest. This wasting syndrome, it occurs because the body does not get enough nutrients, and in the case for AIDS, you could argue that your body is working really, really hard to desperately try and keep you from dying. The immune system is working hard. I mean, your body is under a lot of pressure from, well, everything around it, basically. And now you have the issue where your body is using up more energy than you can provide it. There's a lot of other things that might make somebody with AIDS more susceptible to wasting syndrome, specifically some of the GI issues. And I'm not just talking about nausea, vomiting, diarrhea, although those are totally things that would cause somebody to not want to eat anything, or for the motility of their gut to go down, and now they can't really absorb as much stuff, right? Not only that, they can't absorb things as well because their gut flora is all screwed up because the immune system is not able to keep it in check, so it's not really doing what it needs to do, at least in the way that it needs to do it. And also, people with HIV and AIDS are susceptible to getting mouth sores. Definitely, mouth sores are a big one. And so, after you've gotten these mouth sores, do you really want to eat when you've got these lesions all over your mouth? Well, it's definitely harder to eat those foods that are acidic or citrusy, because, well, now that's going to really burn those areas of the mouth. Not going to be fun. Wasting syndrome kind of is categorized by losing 10% of your body weight without trying to. And it will usually bring somebody from a healthy body weight down to an unhealthy body weight. Now, that's not always the case. If you had a little extra fat to begin with, you may not, appear to, be wasting, even though you might be happy that you lost that weight. It's not usually something that people want. Wasting syndrome is not good. It's not Ozempic weight loss trick. It's it's a product of your body not being able to sustain itself. And then skin changes, those are due to a lot of things. We talked about the lesions that can happen with Kaposi sarcoma. Incidence and prevalence, it's prevalent. 1.8 million new diagnoses annually. So every year, 1.8 new people get AIDS. I mean HIV, sorry. There's a lot of people that live with HIV that hasn't progressed to AIDS because they're able to continue their medication regimen, which we'll talk about in a minute, which is really, really important because we don't want people to get AIDS. We would rather people stick with having HIV, take the precautions they need to, take the medications that they need to, and be able to live a full and happy life. But most cases of AIDS, that be HIV-3, in North America occur among MSN, which means men having sex with men, or adults of either gender that have used injection drugs. Those are our highest risk populations for getting HIV-3/AIDS. Now, we don't want them to get to this point. We want them to stay in HIV 1 or 2 to the point where they have the medication that they need and they're able to take it and use the precautions necessary. But that doesn't happen all the time. Diagnostics. Now, this diagnostic process has changed a lot since they both first figured out that AIDS was a thing. The first thing they'll start off with, of course, history and physical. The important part with history and physical comes down to partners. If you've had a bunch of sexual partners in the last month, we want to track them down. We want to figure out, well, who's got it? Where'd you get it from? If we can figure that out, and then who did you potentially spread it to? That's part of the population health, pipeline. But it's important because we don't want this to continue. We want to make sure people know what they might be at risk for having, so that they can get treated themselves. So we talked about signs and symptoms will be flu-like initially. Night sweats, fever, fatigue, chills. Yeah, just flu-like symptoms. Just feeling a little bit under the weather. For labs, though, this is where things get interesting. Now, back in the day, back when they really didn't have the technology that we do now, they would do this thing called an ELISA test, okay? Which is an older test, but it worked. It worked. It wasn't 100% guaranteed you'd get a correct result. In fact, ELISA tests oftentimes produced false positives, which mean that they said that the person had AIDS, but the person didn't have AIDS. Or I mean HIV. I'm sorry, I say it wrong all the freaking time. It means the person had HIV, but they didn't have HIV. So now they took this ELISA test, they're freaking out, they're like, oh my word, I have HIV, this is terrifying. And then they said, well, okay, but, and then, yeah. So we wanted to make sure that we didn't misdiagnose anybody. So after doing the ELISA test, when they realized that they were false positive, they said, well, we should add in the Western blot test. Now, Western blot test, to make a long story short, it's a lot more reliable than the ELISA test. It does its thing a lot better. Problem with the Western blot test, though, is that it takes weeks to figure out what's going on there. And during that amount of time, the person's virus is replicating and multiplying and potentially even being spread around. So neither of those are really great options. Back in the day, they would do an ELISA test, and then they would do a Western blot test if the ELISA test was positive to make sure that it was right. But nowadays, we have this thing called HIV assays, whatever. And they actually detect antibodies against the HIV in your system, as well as the P24 antigen, to determine if the person has HIV. And this is what's currently used because it works really, really well, and it works faster than whatever else we've got. Another thing that we can use to help figure out if this person have AIDS is lymphocyte counts, okay? Figuring out how many CD4 and T cells we have. This can help us figure out the progression of the disease, like how much damage essentially it's done to our immune system at this point. We'd rather catch it in HIV stages 1 or 2. We don't want to catch it when when our HIV CD or our CD4 and T cells go below 200. We would rather catch it when it's above that. And then last but absolutely not least is viral load testing. Viral load testing tests to see how much of the virus you got. How much do you have made up? This will indicate whether we are at risk for transmitting the virus or not. Now, the good news is, with treatment and really, really focusing on that, you're at a lower risk for transmitting. So somebody will look at, your viral load test and say, oh, your viral load's actually pretty low. That means you're not at risk for transmitting it to anybody. Now, does that mean that you can just stop your safe sex practices or start shooting up your IV needles? No, please don't do that. You can still spread it. It's just that you are decreasing the risk for transmission. You're not getting rid of the risk for transmission, but because there's less virus to go around, less of it's going to be sitting around, which is good. Other diagnostics, stool tests, which are there not to test for the virus, because you can't find the virus in the stool, but what you can find in the stool are abnormalities with your gut, like biome. If you see like microorganisms in there, you'll be like, huh, that's weird. So just some things to think about. Biopsies of, they can go in and take off like bits and chunks of your liver. They can go in and take bits and chunks off of your lymph nodes or whatever. Take out a lymph node, check it out, make sure there's nothing weird going on. And a chest x-ray. That will be for lung infections, and we'll talk about one of them later on that can be especially damaging, as well as CT scans to just see how much the virus is affecting. Because it's not the HIV virus that causes the problems associated with AIDS. It's because the virus specifically attacks your body's ability to recognize friend from foe that you have a lot of different infections that are now working against you because you just can't fight them off. Your body is almost in this weird stasis period. So, yeah, this is just talking about the HIV to AIDS diagnosis, which all has to do with the number of CD4 and T cells available. Less than 200 cells per millimeter cubed, or less than 14%. Less than 14% of the normal count, even if it's above 200. Okay? That's one way of doing it. Or, and this is important, the moment somebody with HIV-2 gets an opportunistic infection, whether that is Kaposi sarcoma, whether that is some sort of bacterial infection caused from like their gut, whatever it is, once they get that opportunistic infection, they have AIDS. They have transitioned from HIV-2 to HIV-3, and right now we're doing damage control. And this is a list of opportunistic infections. Oh my word, those are such long words. Why are they so long, and why do 4 of them start with C? I don't know, dude. It's rough. But we talked about Kaposi sarcoma. Those are our purple lesions that don't feel good. Look at how I spelled lesions. I'm like special needs at this point. Histoplasmosis. Goodness. I think that histoplasmosis is a... bacteria, I don't know. Oh, it's actually, I think it's a fungus. It's a fungal infection. Heck yeah, fungal infection caused by Histoplasma capsulatum. Yeah, I think I've heard that freaking before. Found in soil. So, bro with HIV-3 is hanging out in his garden, enjoying his life, living, laughing, loving, which then he gets too close to the soil, takes in a deep breath, and now boom, histoplasmosis. And it's not cool and pretty. It's looks like all these big little raised dots all over the skin. Yeah. Oops. And then that's histoplasmosis fungus. This is the big one right here. Pneumocytosis gyrovesi pneumonia. See, I got the hard part, and then I looked at pneumonia and said, puh. Stupid. Goodness. I just gotta grab some water, because I've been yapping for too long. This, I'm gonna call it PJP, because I don't want to have to say the whole long freaking word like a million times. Now, pneumocytosis gyrovesi pneumonia is diffuse pneumonia. What does that mean? It means that instead of occurring in like one little area of your like lung lobes like normal pneumonia does, this pneumonia spreads out. They call it a honeycomb appearance, web-like looking thing on an X-ray. This is a big problem, okay? Pneumonia is not good in the first place. Pneumonia limits our body's ability to use part of the lung, which means that our ability to exchange gas is at least a little bit, it's a little harder, okay? At least we have a harder time. With a problem like pneumocytosis gyrovesi pneumonia, boom. I know I said I would call it JPJ, and I haven't done that once, but I just... Shut up. It's diffuse, which means that problem that's usually just consolidated into like one area of the lungs is now basically everywhere. So what would have been really, really not great and needed to be fixed pretty quickly now turns into an emergency where the person can literally not get the air into their lungs that they need to, because the problem of the pneumonia is so widespread that there's like a couple of little corners of viable lung tissue. Everything else is all clogged and messed up and filled with nasty goobers. That's pneumocytosis gyrovesi pneumonia. Any questions? So this is a really huge issue. Sorry, that sweet water is exactly what I need right now. Yeah. Of all the ones on this little page here, that's our biggest priority. Why? Because airway, breathing, circulation. Anyway, moving on. That's breathing right there, by the way. Oh, coccidioidomyosis. Coccidioidomycosis. I don't know. They hit me with 3 I's, 2 D's, 3 C's, and 3 O's. That's too many for my monkey brain to figure out, okay? So we're not gonna really try and say it, but maybe some other time. I think that this is also a fungal thing. Ah, yes it is, a fungus. Oh. Coccidioides. Oh my. I'm too stupid to be able to pronounce this. Coccidioides. Coccidioides? No. What the crack? I'm really slow today. Anyway, it's spread through the inhalation of fungal spores that are present in the soil of certain regions of the United States, Mexico, and Central and South America. So basically, you're living in Arizona and you have AIDS, and then you sniff in some fungal spores, and now coccidioidomyocosis. Dang it, I was close that time. Maybe I should just have Google say it. How to pronounce I don't want to hear about it, Grammarly. I literally don't want to hear about it.
Damn.
We are looking at how to pronounce the name of these diseases, as well as how to say more interesting names from science and medical terms many mispronounce. So make sure to stay tuned to the channel to learn more, become part of the community support. Coccidioidomycosis. Coccidioidomycosis. Stress on the penultimate syllable. Coccidioidomycosis.
Bro almost fumbled that last one. Coccidioidomycosis. That's the stupidest. I'm sorry. I'm like, what? Come on, bro. Coccidioidomycosis. Whoever came up with that needs to be put down. They probably are already 6 feet under. I just needed to say that with my chest, because that's ridiculous. Okay, I gotta sneeze. Whoa. You ever have one of those sneezes where you feel like there was like everything went? That was that for me. Like my nostrils are having like a refractory period after that sneeze. That was perfect, by the way. That's exactly what I needed. Anyway, not that anyone needed to know that. Toxoplasmosis. I think that toxoplasmosis. Oh my freaking! That's the freaking cat one. That's the cat bacteria. Heh. Oh no, it's not a bacteria. It's a parasite. Oh my word! It's a parasite caused by the protozoan parasite Toxoplasma gondii. Common worldwide infection infecting 30% of people. Okay. Consuming undercooked meat, cat feces, drinking unpasteurized milk, getting an organ that has toxoplasmosis. Okay. Fever, swollen lymph nodes, muscle aches, fatigue can cause encephalitis, retinochoroiditis, seizures. What the crap? And of course, not good for babies. So yeah, toxoplasmosis, parasitic protozoa. Because guess what, guys? Plasmosis, protozoa, doesn't work great, but it doesn't work. It doesn't not work. Hey, you riddle me that one. Oh my word! All right, toxoplasmosis, parasitic, protozoa. Yeehaw. Okay, cryptococcus. I don't know who is punching the window downstairs, but I am about done with them. I'm about to go down there and start throwing hands myself. Cryptococcus. I think this one is an actual parasite, not just a protozoan. Cryptosporidiosis. An intestinal infection caused by the parasite Cryptosporidium. Okay. Another protozoan parasite. Okay, so they're both just protozoan parasites. That's cool. Yeehaw. Hey, at least we know. Guess what they both have in them? Peas, protozoan parasite. Oh my word! Ah! This is perfect. Don't worry about the fact that histoplasmosis has one, and that's fungal. Nobody freaking asked, you freaking nerd. Okay. Oh, and look at this one. Oh, nice. Primarily transmitted through the ingestion of contaminated water or food through contact with infected individuals or animals. Most common symptoms of it include watery diarrhea, abdominal pain and cramping, nausea and vomiting, fever and dehydration. GI problems. GI issues. Now we're talking about fluid and electrolyte imbalance. Fluid volume deficit. Okay? Hemoconcentration moment. Okay, we talked about that one. And then cytomegalovirus. Is that a cytomegalovirus? Big freaking cell virus? a genus of viruses in the herpes. Herpes? What the crap? Spread through close contact with somebody who already has it. You can pass it on through contact with body fluids, saliva, blood, breast milk, pee, and poo, and through sex. Dang, that sucks, bro. Herpes! 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 Anyway, I need to go to bed, but I have only eight slides left, so I can take a nap after this before I have to move on to cancer. Okay, well, what's our plan for this AIDS person here who's got these issues? Oh my. Okay. Who's got all these issues? All right. What's our plan? Okay, potential for infection. Duh. Hey, what are all these things? Infections. The fact that our immune system is compromised should be the number one reason you say, oh, well, aren't they immune? Like, don't they have an immune issue? Like, aren't they at risk for infection? Yes, congratulations. That gets you 3 gold stars. Inadequate gas exchange. Oh, why would this be? The answer is PJP. Like, most of the other stuff is, like, skin issues or, like, nausea, vomiting, diarrhea kind of crap. Which, like, I guess if you freaking choke on your vomit or something and have a seizure simultaneously, we have an airway problem. But, like, we're kind of getting a little bit thin there. If you're making up scenarios on how something can be a problem, you are probably going to do great at your job. You're going to probably be on top of it. But ultimately on a test, you don't want to be answering things that you made up. Just a thought. Goodness. Anyway, but for PJP, that's diffuse pneumonia. We are having a gas exchange problem there. Pain. I mean, there's a lot of reasons this person might be in pain. Not only are they potentially having, like, lesions all over their body and, like, a bunch of different issues with Kaposi sarcoma, or, like, fungal infections on their skin, in their mouths. They're gonna have really achy, sore joints, which could cause pain when you're moving. Like, you're gonna be tired all the time. So pain is definitely something that we need to consider for somebody with AIDS. Inadequate nutrition. And we talked about that a little bit beforehand. There's many reasons. I'm not going to say them again because I don't want to. If you want to know, I talked about it the last time. Diarrhea moment. Like, a ton of those things cause diarrhea. A ton of those opportunistic infections cause diarrhea because our GI system has a lot of fun flora that are supposed to stay right there and not travel anywhere else. If they travel anywhere else, boom, now we have massive diarrhea because your GI system is like, hello, who are you? And the little microbe goes, me? Little old me? I'm your worst nightmare. And then they that's so cringe. If my microbe said that to me, I'd be like, get out of here. You're actually fired and canceled. What do you mean? Oh, what do you mean my immune system can't take you out? You need to die on cringe alone. That's crazy. And then with that diarrhea comes reduced tissue integrity. Listen, you're weak. You're not getting out of bed basically at all. You're probably maybe close to bedbound if you're not, getting up and out of bed, maybe, right? And if you are having constant diarrhea, you're at a huge risk for skin breakdown because it's going to be moist. It's going to be moist and nasty. Nasty with a big N, dude. Big nasty. And so now you're sitting in your poop all freaking day. Well, that skin is just going to, like, you know how when you were like... when you're in the water and your skin gets all wrinkly and kind of like flecks off, that's when you know you need to get out of the pool, by the way. If your skin is falling off, maybe you should stop swimming, huh? Anyways, now we've got a huge issue. We do not want this person to be getting pressure ulcers and or skin breakdown underneath their butt because they've been sitting in diarrhea. So clean them up. Clean and dry, period. Cognitive decline. Encephalopathy moment. there's a lot of crap going on, and the infections don't help much. Should I look it up? Yes, fine, I will. Like, cognitive decline in AIDS. Oh my word. Okay. I'm just really sleepy. Primarily caused by the virus's direct impact on the brain and body's inflammatory response to infection, leading to neuronal damage and impaired brain function. Because HIV can cross the blood-brain barrier and infect cells in the central nervous system, primarily macrophages and microglia. The virus can cause neuronal damage through oxidative stress, metabolic changes, and glutamate dysregulation. Oh, the freaking phone. Glutamate, huh? I wonder if you'll start to see, like, ALS type stuff. Wow. I just had a big brain moment. Probably not. Hold on. If glutamate... Oh, frick. Dysregulation. Can I get ALS type symptoms with AIDS? Yes. Oh my freaking goodness. That's a literal thing. Wow. Sometimes my genius astonishes me because I don't know where I pulled that out of. Wow. HIV-associated ALS. That actually sucks. Like, hardcore. That sucks so bad. So anyway, moving on. HIV proteins like those ones also contribute to neuronal damage, can cause a breakdown of white matter. Oh my freaking goodness. Are you joking me? White matter? Yikes. That sucks. And accidental damage impacting brain function. Because the white matter is the stuff that, like, helps you think, right? I wouldn't know. I don't have a lot of it. Basal ganglia and other subcortical structures are particularly vulnerable to HIV-related damage. How nice. Can cause inflammation in the brain. My brain got... Chronic immune activation can also contribute to cognitive decline. Of course, we have toxoplasmosis causing that encephalitis or whatever. I am so retarded. Oh my word. Oh, cryptococcal meningitis. Cryptococcal meningitis is... Yeah, cryptoscosis is probably different. Anyway, comorbid conditions like diabetes can increase risk for those things. Antiretroviral therapy side effects. Well, that's cool. That's kind of nice. Anyway. Yeah, that sucks. And then psychosocial distress, because there's still social stigma about AIDS. I really don't have the heart to go into, like, being a good person, because I feel like that's not something that I should teach anyone, and I don't want to do that. But, however, just be, like, kind and loving and accepting, and know that there's a lot of social stigma around AIDS, and a lot of it just comes down to ignorance and, like, prejudice, and your job is not to change people's minds, but it's to educate and help the people who have AIDS to get the help that they need. Okay? Also know your own bias. Nurse, know thyself. Sometimes there's things you need to figure out in your own life. Things that you need to address with your own self that help to provide everyone the same care that they deserve. Even if they're not nice, everyone deserves care. Evaluation. Did it work? Did we do the thing? Now, when it comes to evaluation of all that stuff, ultimately, if we find somebody and they have HIV, let's say 2, okay? Nobody wants that to progress to HIV 3. So what do they need to do? Take their meds. Take their meds. when they need to, how they need to. I'm not playing games right now. They need to take their meds, no question about it, okay? Because remember, those medications stop the virus from replicating in those key places. So as long as they're taking the medication, that viral load is going to stay low. In fact, it might get lower or something, okay? They need to take their meds. They need to at least 90% of the time, which is such a high percent when right now, typically most of the time, the medication adherence for the average American is like 50%, which is not great at all. So they need to take their meds right away. Like, they need to. They have to. They also need to practice safer sex techniques all of the time, every time. Great, I'm glad to hear your viral load is down. You should still wear a condom. Just saying. Remain free from opportunistic and other infections. Which, as an evaluation, I mean, how do you stop your own body from getting sick from itself? I don't know. I don't know, actually. How do I prevent opportunistic infections? Okay, take prescribed medications, get vaccinated, avoid risky behaviors, practice safe food and water habits, and then seeking medical care promptly. Makes sense. So, just don't put yourself in situations where you could get them. Have adequate gas exchange. I mean, easier said than done for sure. You just have to, if your interventions are helping them have better gas exchange, great. Achieve acceptable level of pain, attain adequate weight and nutrition, maintain tissue integrity, have enough energy to live your life, maintain a support system. HIV treatment is started as soon as possible after diagnosis to help reduce viral load and all of that cool stuff. And you need to keep all your medical appointments. Every time you need to meet up with your PCP and catch them up with what's going on with your life, you need to do that because we don't want HIV to become AIDS. That is not fun for you. That's not fun for anybody. Take HIV medications every day and exactly as prescribed. Now, here's the problem, okay? Every time there's a medication where it's like, you have to take this as prescribed every day, the medication always sucks. Taking that medication always makes you feel like crap, dookie garbage. But it's like, you guys have to take it, please take it. But it's like you feel like awful all day long. And I wish I could say, don't worry, we have an alternative. Unfortunately, I think that's just how medication works. The more important it is for you to take every day, the more it sucks to take. Because it just is so not great, okay? However, the alternative is that you potentially let the AIDS, or let the HIV-2 become HIV-3. So, patient education moment. Blah, 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 blah. So, even skipping one dose allows HIV to multiply, which leads to increased risk of drug resistance. Hey, we actually don't want HIV to become drug resistant, because that means that you will not be able to actually continue to fight it off. Which sucks, actually. That's like a... Yeah. It's awkward because you can't really tell people, like, if you do that, you're gonna literally die. But, I mean, you don't have a great prognosis if you skip a ton of medication doses and now your AIDS is resistant to medication. That's not great. Poor adherence to HIV regimen will also allow HIV to destroy the immune system. And here are our things. Now, it's 5:10. I have music practice in 20 minutes. That's all I have to say. But, there's a couple of key takeaways. Now, we can write down the ones that she wants us to know and put them in some cute little, like, flashcard deck and read them. Most of these drugs cause hepatotoxicity. Okay? So people who come in, and this one causes kidney problems. So the big thing with these is that's why meeting up with your primary care provider and your doctor for your appointments is so important, because they may want to do a variety of different tests on you to see what your liver function tests are all about. How's your AST and ALT? Are they elevated? You know, maybe not necessarily to stop the treatment, but to just check in on the rest of your body systems to see how they're doing, to maybe indicate what kind of other things the provider could potentially do, or what other things you may need to do to kind of help your liver as much as it can, because your liver can withstand a lot. But usually with HIV treatment, they use this thing called ART, which actually, I'm trying to think of the right one, but essentially they give you a drug cocktail, basically. They give you a ton of different drugs. Bam, 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 bam. They're rapid firing the virus in all of its different places of replication. What is the acronym for multiple AIDS drugs? Oh, what the frick. I don't know if they'll have it here. Oh, it's ART. HAART. Highly active antiretroviral therapy. Yeah. Ho, ho, ho. So I was right, kind of. CART is combination. It's just 3 acronyms that really technically mean the same thing, but kind of don't. I don't know. I'm not a freaking doctor. But they're giving you a lot of different drugs all together, which is great. But what you don't want to do is become resistant to all of them at once because you decided to mix and match taking them. That's a terrible idea. Take them exactly as the doctor prescribed them. Anyway, there's a couple that can cause insulin resistance, so keep that in mind if the person has diarrhea. Can also cause exacerbation of hepatitis B. Oh, that's not great, because our liver's already getting absolutely slammed. Ooh. Whoa. That yawn brought something up. Anyway. Okay, summary. HIV can affect anyone. Not just freaking gay people, you freaking loser. Okay, it can affect your mom. How about that? I gave HIV to your mom. That's terrible. It's not a funny joke. It's actually a really sad joke. Nobody wants HIV. I would never do that to anyone. Anyway, treat each client with dignity. As I've so politely shown. Oh, jeez. Anyway, treat each client with dignity. These are people, and this sucks. AIDS is a bad word. Nobody wants that. When you hear that, it's really similar for a lot of people of you have cancer. It can be devastating for them, because you know that this is going to be a disease you're going to have to fight for your whole life to against, which really sucks. And the big thing with this is to promote as much health with this person as you can. You want to try and hold off those really, really bad symptoms of opportunistic infections for as long as possible by keeping that person adherent to their medication list. And, yeah, that's kind of the big thing. Like I said, I'll go over any drugs I need to go over for the test, but right now, those are the big things that you need to know about HIV and AIDS.